Top 20 NHS Band 2 Interview Questions and Answers. Are you preparing for an NHS Band 2 interview? Whether you're applying as a healthcare assistant, support worker, or clerical role, this guide covers the top 20 most commonly asked questions with clear, confident answers. These insights will help you stand out, align with NHS values, and show you're ready to make a real impact in patient care. Get ready to boost your confidence and walk into your interview fully prepared with answers tailored to Band 2 expectations. 1. Can you tell me about yourself and your experience relevant to this role? I have a strong background in healthcare support roles, including voluntary and part-time work in care homes. My experience includes assisting with personal care, mobility, feeding, and emotional support for patients. I'm a compassionate, reliable individual with good communication and teamwork skills. I hold a Level 2 health and social care qualification and understand the importance of maintaining dignity and confidentiality. I'm passionate about helping others, and I'm now seeking to expand my experience in an NHS Band 2 role, where I can contribute positively to patient care and continue learning within a professional healthcare setting. 2. Why do you want to work for the NHS? I want to work for the NHS because it represents care, compassion, and equality, values I strongly believe in. I admire the dedication of NHS staff in providing high-quality healthcare for all, regardless of background. Being part of such an institution would allow me to contribute to the well-being of others and grow professionally in a meaningful way. The NHS also offers excellent training and career development, which motivates me further. I am committed to supporting both patients and healthcare teams, and working for the NHS gives me the opportunity to make a real difference in people's lives. 3. What do you understand about the duties of a Band 2 role? A Band 2 role involves supporting patients with their daily needs and assisting clinical staff. This can include helping with personal hygiene, feeding, mobility, and emotional support. Other responsibilities may involve taking observations, maintaining accurate records, and ensuring a safe, clean environment. Band 2 staff must uphold patient dignity, follow care plans, and work collaboratively with healthcare professionals. They also play a crucial role in infection control, safeguarding, and patient communication. While tasks can vary, the focus remains on delivering compassionate care, supporting well-being, and ensuring the highest standards of safety and respect in a healthcare setting. 4. How do you ensure patient dignity and respect in care? I ensure patient dignity by treating every individual with compassion, privacy, and equality, regardless of their condition or background. I always knock before entering a room, explain what I'm doing, and obtain consent before proceeding with care. I maintain confidentiality and avoid discussing patients in inappropriate settings. I offer choices and encourage independence where possible, helping patients feel respected and in control. I use respectful language and maintain a calm, supportive demeanor. Upholding dignity means being present, listening attentively, and making the patient feel safe, comfortable, and valued throughout their care experience. 5. Describe a time you worked under pressure. During a busy shift at a care home, several residents required assistance simultaneously while a medical emergency occurred. I remained calm, prioritized tasks, and worked closely with colleagues to ensure safety and care continuity. I focused first on the emergency by alerting the nurse and assisting with stabilizing the patient. I then returned to assist other residents, communicating clearly to reassure them and manage expectations. Despite the pressure, I ensured that documentation was completed accurately afterward. This experience taught me to stay composed, communicate effectively, and work as a team to deliver care during challenging moments. 6. How would you handle a distressed patient or service user? When handling a distressed patient, I remain calm, speak softly, and listen without interruption. I acknowledge their feelings, offer reassurance, and try to understand the cause of distress. If appropriate, I involve a senior or nurse for additional support. I avoid confrontation and give the person space if needed, while ensuring their safety. I use distraction techniques or comforting conversation to redirect their focus. Throughout, I maintain a respectful and empathetic approach. Afterward, I document the incident clearly and reflect on how the situation was managed to improve future responses and patient experience. 7. Can you explain the importance of confidentiality in the NHS? Confidentiality is essential in maintaining trust between patients and healthcare staff. It ensures that personal and medical information is protected and only shared with relevant professionals on a need-to-know basis. In the NHS, we follow data protection laws and internal policies to safeguard patient data. Breaching confidentiality can lead to distress for the patient, loss of trust, and legal consequences for staff. I always ensure information is shared appropriately, securely stored, and not discussed in public areas. Respecting confidentiality shows professionalism and respect, and it is central to delivering safe, ethical, and compassionate care. 8. What does safeguarding mean to you? Safeguarding means protecting people, especially vulnerable individuals, from abuse, neglect, and harm. It involves being alert to signs of physical, emotional, or financial abuse and acting immediately if concerns arise. In a healthcare setting, this means reporting concerns to the appropriate safeguarding lead, documenting observations, and following procedures. It also includes promoting a safe environment, respecting individual rights, and ensuring all care provided is person-centered. I believe safeguarding is everyone's responsibility, and I am trained to recognize signs, act professionally, and ensure patient safety is always a top priority. 9. How do you handle challenging behavior from patients or colleagues? When facing challenging behavior, I stay calm, professional, and avoid reacting emotionally. I try to understand the cause, whether it's pain, confusion, or frustration, and respond with empathy. I use de-escalation techniques such as active listening, clear communication, and giving space. If needed, I seek support from colleagues or supervisors to manage the situation safely. I never take behavior personally and always treat individuals with respect. Afterward, I reflect on what happened, document the incident, and look for ways to prevent similar situations. Handling challenges professionally helps maintain a safe and respectful working environment. 10. Describe a time you worked as part of a team. In a previous care assistant role, I worked with a team to prepare for a large patient discharge while managing routine care. We held a brief team huddle to assign roles. Some handled paperwork, while others assisted with medication, transport, and patient communication. I supported a colleague with mobility care while helping update patient records. We communicated throughout and adapted quickly when changes arose. The teamwork ensured a smooth discharge and maintained high care standards. This experience taught me the value of clear communication, flexibility, and mutual support in achieving shared goals in healthcare settings. 11. How do you prioritize your tasks during a busy shift? During a busy shift, I assess urgency and patient needs first. Tasks involving safety, medication, or critical care take top priority. I use a checklist or task sheet if available and communicate with the team to coordinate responsibilities. I remain flexible as priorities can change quickly. I ensure each task is completed thoroughly but efficiently, and I document care accurately. When unsure, I seek guidance from a senior. Good time management, teamwork, and clear communication help me stay organized and responsive to patient needs, ensuring no one is overlooked even during the busiest times. 12. What would you do if you saw a colleague not following procedures? If I observed a colleague not following procedures, I would address it professionally. If appropriate, I might gently remind them in the moment. However, if the issue posed a risk to safety or care quality, I would report it to a supervisor or follow the whistleblowing policy. It's important to protect patients and uphold standards, not ignore concerns. I would document the incident if required and remain objective and respectful. The focus should always be on safeguarding patient well-being and maintaining trust in the healthcare environment. Accountability ensures the whole team works safely and ethically. 13. How do you ensure accurate documentation and record keeping? Accurate documentation is vital for continuity of care, legal protection, and communication within the team. I always write clearly, legibly, and use the correct format. I record information as soon as possible after providing care, ensuring it's factual, timely, and objective. I avoid assumptions and use standard terminology. If I make a mistake, I follow the correct procedure to amend it without erasing the original entry. Confidentiality is key, so I ensure records are stored securely and shared only with authorized staff. Consistent and accurate documentation supports safe and effective patient care. 14. Are you familiar with infection control procedures? Explain. Yes, I am familiar with infection control procedures. These include regular hand washing, wearing appropriate personal protective equipment, PPE, safely disposing of clinical waste, and cleaning equipment between uses. I follow the bare below the elbows policy and adhere to guidelines for isolation and outbreak control. I stay updated through training and remain vigilant for signs of infection. Infection control protects both patients and staff and is essential in preventing the spread of illness. I take my responsibilities seriously and ensure that I follow protocols strictly to maintain a clean, safe, and hygienic environment. 15. How would you handle a situation where a patient refuses care? If a patient refuses care, I respect their decision and try to understand the reason calmly. I ask open-ended questions to explore their concerns and provide reassurance or alternatives where possible. I never force care but explain the potential risks and benefits clearly. If necessary, I involve a nurse or senior to support the discussion. I document the refusal and my actions accurately. It's important to uphold the patient's rights and autonomy while ensuring their safety and offering ongoing support. Building trust can sometimes lead to the patient accepting care later on. 16. What are the NHS values and how do you embody them? The NHS values include respect and dignity, compassion, commitment to quality of care, improving lives, working together, and everyone counts. I embody these by treating every patient with kindness and respect, maintaining confidentiality, and offering care that supports both physical and emotional needs. I strive to improve my skills, collaborate with colleagues, and always act in patients' best interests. I understand that every individual matters, and I take responsibility for delivering consistent, person-centered care. These values guide my decisions, actions, and interactions every day in the healthcare environment. 17. How do you maintain professionalism at all times? I maintain professionalism by being punctual, respectful, and dependable in all my interactions. I follow policies and procedures, dress appropriately, and communicate clearly with patients and colleagues. I respect confidentiality, remain calm under pressure, and manage personal boundaries carefully. I stay focused on my responsibilities and avoid engaging in gossip or negativity. I take pride in representing the NHS and understand that professionalism builds trust and ensures high standards of care. I also actively seek feedback and development opportunities to continue growing in my role and serving patients with integrity and compassion. 18. Describe a situation where you showed empathy in a work setting. In a care home, a resident became upset after receiving bad news. I sat with them quietly, held their hand, and allowed them to express their feelings without rushing or interrupting. I listened attentively, offered comforting words, and stayed present until they felt calmer. I also informed the senior nurse so additional emotional support could be arranged. This experience showed me how small gestures of empathy can greatly comfort someone in distress. Showing genuine care and understanding helps patients feel heard, valued, and safe, something I prioritize in every interaction. 19. How do you deal with feedback or criticism? I welcome feedback as an opportunity to improve. I listen calmly, avoid becoming defensive, and ask for clarification if needed. I reflect on the feedback and take practical steps to make improvements. Constructive criticism helps me grow both personally and professionally. If the feedback is positive, I take it as encouragement. If it's critical, I see it as a chance to do better. I also regularly ask colleagues or supervisors how I can improve. Being open to feedback is essential in healthcare, where high standards and continuous improvement are key to patient safety and satisfaction. 20. What training or skills do you hope to develop in this role? I hope to develop both clinical and interpersonal skills in this role. Specifically, I'd like to enhance my understanding of patient observation, infection control, and dementia care. I'm also interested in training opportunities such as first aid, safeguarding, and communication in difficult situations. Long-term, I would like to pursue a Level 3 qualification and potentially progress into a Band 3 or nursing assistant role. I'm committed to continuous learning and believe every shift offers new experiences and lessons that help me become a more skilled, confident, and compassionate healthcare professional. Thanks for exploring the top 20 NHS Band 2 interview questions and answers. These responses are designed to help you demonstrate your skills, compassion, and understanding of NHS values. Preparation is key. Review each answer, tailor them to your experience, and practice speaking confidently. Whether you're new to healthcare or building on previous experience, showing empathy, professionalism, and commitment can set you apart. Good luck with your interview, and remember, you're not just applying for a job. You're stepping into a role that truly makes a difference. Stay confident, stay caring, and shine.